In-servicing the Luminexx vascular and biliary stent systems is quick and easy to perform. The Luminexx vascular and biliary stent system is comprised of a self-expanding, electropolished stent delivered over an 0.35-inch guide wire on a 6 French platform. These stent systems, however, have different FDA clinical indications, which dictate the commercially available size offering for each system. The Luminexx biliary stent is indicated for the treatment of biliary strictures resulting from malignant neoplasms. It's available in diameters of 4 to 14 millimeters and lengths of 20 to 120 millimeters on both 80 centimeter and 135 centimeter catheters. The Luminexx vascular stent is indicated for the treatment of iliac occlusive disease in patients with symptomatic vascular disease of the common and/or external iliac arteries up to 126 millimeters in length with reference vessel diameters of 5 to 9 millimeters. It's available in diameters of 7 to 10 millimeters and lengths of 20 to 100 millimeters on both the 80 centimeter and 135 centimeter catheters. The Luminexx vascular and biliary stent is pre-mounted on a barred safe delivery system. SAFE designates secure, adhesive-free tip design. The distal catheter is specifically designed to apply compression along the entire length of the stent to prevent unintentional movement or misplacement during deployment. The inner catheter is tipless, reducing the risk of catheter entanglement post-stent deployment. The outer catheter is a multifunction braided catheter, providing an optimal balance of delivery system pushability, trackability, and kink resistance, even in tortuous anatomy. The Luminexx stent diameter should be sized approximately 1 to 2 millimeters larger than the normal vessel lumen diameter. Approximately 5 to 10 millimeters of the stent should extend beyond each end of the lesion. Prior to the introduction of the delivery system, both female lure ports located on the handle, also known as the Performax grip, must be flushed with normal saline. The user should flush the lure port for the inner catheter located at the proximal end of the delivery system. Flush the inner catheter or guide wire lumen with sterile saline, using a syringe until the saline leaks from the tip of the catheter and all the air is removed. Next, flush the female lure port found within the T-lure adapter located on the top of the delivery system. This port flushes the constrained stent mounted between the inner and outer catheters. Flush with sterile saline using the syringe until saline leaks from the tip of the catheter and all the air is removed. The Luminexx vascular stent system is now prepped and ready for delivery. Under fluoroscopic guidance, the operator should advance the stent across the lesion. The 4 tantalum markers on each end of the Luminexx stent are designed for exceptional visibility under fluoroscopy. The operator should use these radiopaque marker bands to center the stent across the lesion. Advance the stent just beyond the lesion and gently pull back slightly on the entire system to position the stent accurately and remove any slack from the catheter. Just prior to deployment, remove the red safety clip by pressing the 2 red tabs together, removing the clip from the Performax grip. Reconfirm stent position under fluoroscopy. The Luminexx vascular and biliary stent with Performax grip is a multifunctional stent deployment system that offers 4 different stent deployment options: the trigger method, the slide method, the combination of trigger and slide, and the conventional pin and pull method. In the trigger method, deployment can be accomplished by pumping the trigger of the handle. This method offers microclicks of approximately 2 millimeters at a time for ultimate control, or full pumps of the handle for rapid one-handed stent deployment. In the slide method, the stent can be deployed by pulling back the slide mechanism. The combination method utilizes the trigger method until the stent has achieved wall apposition, and then the operator switches to the slide method to complete the deployment. The conventional method requires the user to remove the white conversion tab before snapping the catheter out of the Performax grip. The stent can then be deployed using the conventional pin and pull technique by pulling back the T-lure adapter. No matter which deployment method is selected by the operator, a few basic guidelines should be observed. First, ensure that the deployment system is straight. The operator should keep slight back tension on the Performax grip, which may be accomplished by fixing the grip to a stationary surface. The radiopaque tantalum markers on the Luminexx stent ends should not move during stent deployment. However, The radiopaque marker band on the outer catheter moves backwards towards the proximal markers on the stent during stent release to indicate deployment of the Luminexx. Be sure the operator does not hold or kink the outer sheath of the delivery catheter, since it must be free to move during deployment. Full release of the Luminexx stent is achieved when the radiopaque proximal and distal marker bands are fully expanded and visualized fluoroscopically. Do not attempt to resheath the deployment system after stent release. Withdraw the deployment system. Post-dilatation of the Luminexx vascular and biliary stent with an appropriately sized balloon dilatation catheter is left to the discretion of the treating physician. Congratulations, you have just learned how to in-service a clinician on how to prep and deploy the Luminexx vascular and biliary stent system.